Hello dear friends, here we are going to talk about another question of cardiology. A 65-year-old man presents with recurrent lightheadedness for 1 month, especially when he gets up from bed in the morning. He also has occasional episodes of lightheadedness when standing for prolonged periods of time. He suffers from hypertension and type 2 diabetes. His regular medications include atenolol, amlodipine, benzoylflumethiazide, and metformin. As we can see, the patient is on multiple antihypertensive drugs. On physical examination, his blood pressure is 125 on an 85 mm Hg taken when he is supine and 101 on 69 mm Hg when standing. It means that the patient has postural hypotension. What is the single most likely diagnosis? Okay, A. Acute hypotension. B. Vasovagal faints. C. Postural hypotension. D. Postprandial hypotension. E. Aortic stenosis. As we said, the patient has a postural hypotension. Here we are going to talk about postural hypotension or orthostatic hypotension. Postural hypotension should always be considered in elderly patients, especially if they are on multiple medications and presents with dizziness. The baroreflex mechanisms, which control heart rate and vascular resistance, decline with age, particularly in patients with hypertension who thus display liability in blood pressure. They are particularly prone to postural hypotension and to the effects of drugs. It may present with dizziness or sudden loss of consciousness after getting up from a chair with recovery within a minute. Diagnosis is blood pressure is taken when lying down and sitting and standing up. Okay, postural hypotension is defined as a drop in blood pressure of more than 20 mm Hg after 3 minutes of standing, and this is important. If the patient has 20 mm Hg drop in blood pressure after taking it in 3 minutes, after 3 minutes of standing, it means that the patient has postural hypotension or orthostatic hypotension. One of the most common causes of postural hypotension is dehydration, especially in old patients. This is the reason that urine and electrolytes are always requested if one presents to the hospital with collapse, with the likely reason being postural hypotension. A rise creatinine and urea would support dehydration, and hydration using intravenous fluids would be key if dehydration is the cause. Here is some golden points for dizziness, and we are going to explain it. When the patient feels dizzy when rolling our bed, we must think about benign paroxysmal positional vertigo. But when light sensitivity during dizzy spells, we must think about migraine headaches. When the patient's first attack is severe vertigo and lasting hours with vomiting, we must think about vestibular neuritis. When lightheaded when getting up from bed, we must think about orthostatic hypotension, as we can see in this patient. And when the patient is one ear feels full before or during a dizzy attack, we must think about Meniere's disease. Here was a short explanation about the patient coming with postural hypotension because of using multiple antihypertensive drugs. Thank you for your attention.